Welcome to our comprehensive guide on Tocilizumab, a medication that has garnered attention in the medical community. Today, we'll explore everything you need to know about this impactful drug. Tocilizumab, also known by its brand name Actemra, is a biologic medication primarily used to treat moderate to severe rheumatoid arthritis, polyarticular juvenile idiopathic arthritis, systemic juvenile idiopathic arthritis, giant cell arteritis, systemic sclerosis-associated interstitial lung disease, COVID-19, and cytokine release syndrome. Tocilizumab is a recombinant humanized anti-human interleukin-6 (IL-6) receptor monoclonal antibody of the immunoglobulin IgG subclass. This medication works by blocking interleukin-6, a cytokine involved in inflammation. By inhibiting this pathway, tocilizumab helps reduce the painful inflammation and progression of joint damage in arthritis patients. Tocilizumab is administered either through intravenous infusion or as a subcutaneous injection. The method of delivery and dosage often depend on the patient's condition and medical history. For adults with rheumatoid arthritis, the typical dose involves an IV infusion every 4 weeks. The subcutaneous injection dosage may vary, usually administered every 1 week. It's important to understand the potential side effects of tocilizumab. Common ones include upper respiratory tract infections, nasopharyngitis, headache, hypertension, increased ALT, and injection site reactions. More serious side effects, though less common, include severe infections, intestinal perforation, and changes in blood cell counts. Patients must be closely monitored for these risks. Actemra is contraindicated in patients with known hypersensitivity to Actemra. Serious infections. Do not administer Actemra during an active infection, including localized infections. If a serious infection develops, interrupt Actemra until the infection is controlled. Gastrointestinal perforation. Use with caution in patients who may be at increased risk. Hepatotoxicity. Monitor patients for signs and symptoms of hepatic injury. Modify or discontinue Actemra if abnormal liver tests persist or worsen, or if clinical signs and symptoms of liver disease develop. Laboratory monitoring. Recommended due to potential consequences of treatment-related changes in neutrophils, platelets, lipids, and liver function tests. Hypersensitivity reactions, including anaphylaxis and death, have occurred. Live vaccines should be avoided with Actemra. Use in pregnancy, based on animal data, may cause fetal harm. During lactation period, discontinue drug or nursing, taking into consideration importance of drug to mother. Before starting tocilizumab, patients should undergo screening for tuberculosis and other infections. The drug can increase susceptibility to infections due to its immune-suppressing effects. Patients with pre-existing liver conditions, neutropenia, or diverticulitis should discuss potential risks with their healthcare provider, as tocilizumab might exacerbate these conditions. Regular monitoring is crucial while on tocilizumab. This includes periodic blood tests to check liver function, lipid levels, and complete blood count to ensure the medication's safety and efficacy. Diet and lifestyle adjustments may also be necessary to optimize treatment outcomes and minimize side effects. Patients should consult with their healthcare provider for personalized advice. In conclusion, tocilizumab is a powerful tool against rheumatoid arthritis and other inflammatory diseases. Its ability to specifically target inflammation pathways offers significant benefits but comes with necessary precautions. For those considering or currently using tocilizumab, staying informed and engaged with your healthcare team is key to safely managing your condition. Thank you for joining us today to learn about tocilizumab. Remember, each patient's journey is unique, so always consult your healthcare provider for advice tailored to your health needs.